My name is Dr. Joseph Park. I am an interventional radiologist for the PIH Health hospital systems. It's three hospitals in the Los Angeles County area. I went to college at Johns Hopkins. After that, I went to med school at Loyola University Medical Center in Chicago, where I also did my residency. And then after I finished diagnostic radiology residency, I did fellowship in interventional radiology at UCSF Medical Center in San Francisco. So I work for the PIH Health system. It is a network of hospitals. There are three of them right now. And those three are Good Samaritan in downtown, and then PIH Health Whittier, which is in Whittier, and then PIH Health Downey, which is in Downey. So I guess I always thought that I was going to become a doctor. My mom probably planted that seed in my mind because she was a nurse. And I remember like looking through her anatomy books when I was like really young, being fascinated by the human body. And then also whenever I visited Korea, I would get to meet my uncle who was a pediatrician. So I just kind of had that in the back of my head throughout, school and then going to college. I was a pre-med major basically. And then, I went into medicine thinking that I was going to be a pediatrician like my uncle. But, once you're in med school, you get to experience a lot of different specialties. And I quickly realized that I didn't like dealing with screaming babies and kids all day. But then I found radiology, which is very interesting to me because it's very visually oriented. It's all about medical imaging, and it requires an in-depth knowledge of the human body and of different pathologies and disease states, which I was always fascinated about, just how the human body works, including, when things go wrong, why the human body has certain diseases. It was like the perfect fit for me. So I wish I could sum up radiology in like a few sentences, but to be honest, medical imaging encompasses so many different modalities, different techniques of imaging. So the word radiology includes the word radio, which was based on the fact that X-rays were all about radiation. And, the early X-rays you see of, I think it was Röntgen who took pictures of his wife's hand with a ring on it. And so that's how radiology started. But then over time, there are other modalities that were included like ultrasound, MRI. There's also nuclear medicine. And then there's also interventional radiology, which is minimally invasive imaging guided procedures, which is what I do. So at its core, it's about medical imaging, but it covers such a wide variety of imaging within the medical field. I guess the regular day would be like starting at 7 to 8 a.m. and then being done usually by 5 o'clock, unless if I'm on call. If I'm on call, then I'm there until the work is finished. And when you're on call, it also means having to come in the middle of the night for emergencies. So it varies. But I would say for diagnostic radiology, where you're just doing medical imaging, it's pretty much set hours, whatever hours your shifts is. That's how you work. Some jobs even allow you to work from home remotely, just like on a computer over my shoulder like that. But interventional radiology, where you're doing minimally invasive procedures, that's a little bit busier because there's a lot of call and having to come in either in the middle of the night or on the weekends, take care of patients. The thing I like the most about radiology is that it's like the perfect intersection of medicine and technology for me. I love the fact that with improved technology, there's always new techniques of imaging, better quality of imaging that's coming out. And then with interventional radiology, not only do I get to use my visual skills, but also putting it into practice with my manual skills, doing very fine motor movements with, catheters, wires, different tools that we have to do procedures on patients. So I find that really gratifying. I think the biggest challenge is trying to stay up to date on the imaging. It also depends on what kind of practice you're involved with. If you're in a multi-specialty practice that has a lot of specialized people who only focus on certain aspects of medical imaging, um, then all you have to learn and keep up with is what you do. But if you're a general radiologist who has to basically do a little bit of everything, that just requires a lot of knowledge and keeping up to date with the improved quality of imaging, better techniques of imaging, which is a lot of information to process. And time, because there are very few patients that come into the hospital who don't have some sort of imaging done, whether it be an X-ray or CT or ultrasound. And so there's constantly imaging studies that are showing up on our reading list that we have to keep up with and make sure that we do a good job of interpreting it, but also getting reports on the imaging back to the clinicians in a timely manner so that they can get those results and appropriately treat their patients without delays. So I would say those are the major challenges with diagnostic radiology. So, all doctors are required to do CMEs to stay current on their medical license. So, whether that through reading journals, attending conferences, various meetings that are done in the hospital, like M&M meetings or cancer conferences, all of those things contribute to being able to stay up with the latest up-to-date standards for medical care, getting those credits so that we fulfill our licensure requirements. So I can't really say too much about that in terms of diagnostic radiology, just medical imaging in general. But as far as in my specialty with interventional radiology, there's constant developments. One of the developments with what we do with stroke care is stroke thrombectomies. That's when we retrieve blood clots from the brain using specialized devices. They're called stent retriever devices. It's basically like a stent that's attached to a wire. And when you deploy that stent in a blood vessel, it grabs onto the clot almost like a net. And then basically you drag it out through a small catheter. And if you can successfully remove the clot, then it'll restore blood flow. And if you do it rapidly enough, there's a chance that the patient's stroke symptoms can improve or even completely resolve in the best case scenario. Also, another example lately would be prostate artery embolization. So a lot of older males suffer from something called benign prostatic hypertrophy, BPH. Basically, the prostate gland, which sits under their urinary bladder, enlarges. And when it does that, the urethra that's going through that prostate gland can get choked. And a lot of times, what ends up happening is these guys just cannot empty their bladders when they pee. And so they have to pee constantly and only little bits at a time. Now, in the past, that was treated with surgery or something called a TURP, where they would go in and they would basically shave the inner lining of that prostate gland to create a bigger channel for the urine to go through. But something that interventional radiology now offers is something called prostate artery embolization. That's when we can actually do an angiogram and feed very, very thin tubes, even thinner than angel hair pasta. And basically, we navigate these catheters to the arteries in the pelvis that supply the prostate gland. And once you're in there, you can inject these tiny little beads that will flow with the blood and get lodged into the capillaries in the prostate gland. And by choking off the blood supply, you cause the gland to atrophy. And a lot of patients who are requiring all these medications and doing all these procedures and still having problems after this prostate embolization procedure, then they can urinate fine with no problems. Which, as I'm getting older, I'm realizing that a lot of just our normal bodily functions we take for granted, but something like that's causing a lot of frustration, being able to treat that in a non-surgical way is very gratifying. I'd say the best advice I can give is that you have to love medicine in general to go into it. Because I think if you're going into it for any other reasons like making money, things like that, it's just not worth the effort and time and the sacrifices to go through that, all the time spent with studying, all the cost of the medical education, the sacrifices that you have to make to spend time away from your family because you have responsibilities that you need to fulfill in the workplace. But if you love medicine and you love treating patients and making a difference in the health of people's lives, I think all that hardship and sacrifice feels like it'll be totally worth it. And of course, it's med school is definitely not easy, but I don't think the hardship of medical education in itself should not be a deterrent for anyone who has the passion to go into it. I think it's a matter of how much effort you're willing to put into it.